So again, welcome everybody. We are talking all about midlife metabolism and modern peptides. We're going to talk about men's aging, women's aging. Well, we're going to touch on GLPs, but we're also going to touch on peptides for other things like longevity, sexual health, skin, and lots of other things. So, just to give you guys a little background on me, some of you guys know me, but many of you don't. So, my name is Lori Werner. I'm the host for the webinar tonight. My day job is I'm actually the founder of Medical Marketing Wiz, and we are a marketing agency in our 10th year. And I have the privilege of working with hundreds of functional and integrative medicine focused providers across the entire United States. I am also part of many longevity focused societies, such as the Age Management Medical Group. I'm a member of the Menopause Society, the Advanced Practitioners Network, and am involved with AMSPA. And I'm also very passionate about helping women through menopause. So I'm a certified menopause coach and a brand partner at LAMD. And just on a personal side, why I've really gotten into just health, wellness, and longevity. I've honestly been very healthy focused my entire life, but it was when menopause hit me probably 10 years earlier than what it does most people. I went through menopause at 41. I went from somebody that was a very glass half full sort of person, high energy. I could honestly eat an entire pizza and I would not gain a pound. And that completely came to a screeching halt when I hit menopause. Not only that, I really felt kind of depressed and not able to conquer my day like I used to before. And so now that I have really invested in my health and wellness over the last 7 or 8 years, I just want to tell other people about it because I know that not everybody has the ability to go to a functional medicine provider. Yet there's so much great information out there, and I want to connect you guys with some of the thought leaders in this industry so that you can take control of your health and really be informed. I did want to share just my personal peptide favorites and what I take. So this is me the day that I dropped my daughter off for college. And this was me just about a year and a half later. And I started my peptide journey about it was January of last year. And I started GLP-1s, the tirzepatide, and I just do a baby dose. So what they call microdosing. And we're going to talk about that just really to kind of get rid of those last, 15 to 20 pounds that just wouldn't budge, even though I was doing, all the things. I was still eating healthy. I was exercising. I was getting my steps. I don't drink soda. I don't eat fast food, but basically menopause hit and everything kind of came to a screeching halt. I tried a lot of different things. I've tried fasting. I've tried, gluten free, and until I started microdosing GLP-1s, it was the very first thing that I feel like has actually worked. The other thing that I've added to my stack is I do GHK-CU, which is a skin peptide, which we'll talk about. I also do NAD and then BPC 157 TB 500. This is called the Wolverine stack, and I've personally used it for frozen shoulder. So it's great for injuries as well as joint health. And then I do like to be transparent. I am also on bioidentical hormone therapy. I've been doing that since 2021, and I do go to Pure Barre. I highly recommend Pure Barre. In fact, I'm going to go to it right after this webinar tonight. In my opinion, it is the best workout for menopausal women. So definitely check it out. And these are my results from my in-body scan in terms of my body fat mass reduction, my percent body fat, really being able to, for the most part, maintain muscle mass and just kind of get rid of some of those unwanted pounds. So, what we're going to talk about today, and again, I have a jam-packed group of experts that are going to talk and give you guys some really great insights on these different peptides, but we're going to talk just briefly about midlife metabolism for men and women and all the fun things that we experience. We're also going to talk about what peptides actually are. So, just a little bit of the history of peptides. We'll touch on kind of the highlights of the major peptides that you may have heard of or want to be aware of for weight loss, longevity, joint health, gut health. We're also going to talk about the health assessment process because the company that I work with and that we're talking about tonight is LAMD, and they are a telehealth platform. We're going to talk about what that health assessment process looks like with the medically supervised peptides, your access to MDs and DOs through their platform, and then kind of where these peptides are coming from. And you can, be educated, learn if this is a good fit for you, and we can talk about next steps. And then at the very, very end, we do have a good number of business people or other people that are interested in peptides and maybe want to learn a little bit about how to do this as a business. So at the very, very end, I will touch on that. So if you're interested, you can stay to the end, but I'll kind of let you know when we get to that part. So, first and foremost, I love this meme because this is totally me. It was like, happy menopause. I'm here to steal your energy, your libido, your mood, your memory, and the muscle tone in your upper arms. And I think we can all kind of relate to that a little bit. And the truth is that when you look at midlife trends for women, if you are experiencing weight gain, this is normal. During perimenopause and menopause, on average, women will gain about 15 pounds. And it's mostly due to the loss of some of the amino acids and things in our body that we used to have when we were younger. And peptides are a way to replace that. And this is why we get body fat accumulating. For women, it tends to be kind of in our midsection or in on our hips. We lose muscle mass. When we lose muscle mass, our caloric burn is less and it makes it harder and harder to lose weight. And then, of course, sleep, right? When we don't sleep right, it makes it difficult to even have the motivation, to be healthy and do all of those things. But menopause definitely does disrupt our sleep. And same thing for men, right? So I think we all can agree, our hubbies that might have had the six-pack abs all of a sudden, out of nowhere, they're kind of getting the little beer belly. And this happens to them as well because between ages 30 and 55, they start accumulating body fat. Now, theirs tends to be more in the middle and what we call visceral fat. So, this is the fat that gets around all of your organs. It's actually the most dangerous fat in terms of health. And it's associated with insulin resistance as well as cardiovascular disease and type 2 diabetes. And there's also other health risks associated with weight gain. So, it's not just weight gain, but heart and metabolic diseases, sleep apnea. Again, I feel like, all of a sudden it's like, my husband, why is he snoring all of a sudden? Well, when you get a little bit heavier in middle age, that fat accumulates around the neck and the airway and it interferes with normal breathing during sleep and you start snoring. My dad actually, when my dad passed away a few years ago, one of the things that the doctor told me, the reason why he died was because of undiagnosed and prolonged sleep apnea. And so it does cause a lot of issues. We've got cancer, joint problems, as well as mental and cognitive health. So it's important, and I applaud you guys for being on here and learning about some of the ways that you can more naturally help reverse a lot of this. So I do want to touch just briefly on what is a peptide, and I'm going to touch on the history of peptides, and then I'm going to bring up my first panelist. So what is actually a peptide? So a peptide is a short chain of amino acids, and these are the building blocks of protein. And basically what they do is they just act as messengers to the body. And so things like repairing tissue, when you use something like BPC 157, it tells your body to repair. If you think about it, as you get older, when you have an injury, it seems like it's a lot harder to get back than when you were a kid. And that has to do with losing some of those amino acid chains that you had when you were younger. Same thing with GLP-1s. Like, why was it that I used to be able to, eat a whole pizza and not gain any weight? And then all of a sudden that came to a screeching halt. Well, it does have to do with the loss of GLP-1s in my body. And so being able to just replace that just tells your body to do the things that it used to do when you were younger. So this is not a pharmaceutical. This is not a chemical. This is literally a messenger that's just telling your body to do what it used to do. And there are peptides that support metabolism, energy, mood, sleep, and overall vitality. And we'll touch on a few of those. So I did also want to just briefly mention the history of peptides. And this is really because I think peptides are becoming, we're aware of them now, but these have been around for a really long time. So if you think of, the history of peptides back in the early 1900s, the very first peptide that was discovered was actually insulin in 1922. And we know that insulin is now used by millions and millions of Americans to live an optimal, healthy life if they have type 1 or type 2 diabetes. Collagen is another long-standing peptide. And this has been used for decades in surgical repair, joint health, skin health, and all of these collagen powders that have become more and more trendy. Um, so even though peptides might seem new, they've really actually been part of medicine for over 120 years. And we're simply just entering this moment where science is unlocking the full potential and it's becoming more mainstream. So, and with that, I've always said that the secret sauce with these I didn't know what the secret sauce was, to be honest, of, Jennifer Aniston and Gwyneth Paltrow and Hugh Jackman and Joe Rogan is talking about peptides on his podcast. These celebrities have been using these peptides for years. And again, now it's just really becoming more mainstream for everyday people to tap into some of that longevity and anti-aging that these celebrities have had access to. So, actually, before I go into the LEMD piece, I'm actually going to have Colleen Lochran come on, and she is a nurse practitioner and owner of Emerald Health and Wellness. And I would love, Colleen, if you wouldn't mind, just sort of share with us a little bit about. I know you've had a journey from sick care to preventative care. If you wouldn't mind sharing that with us, we would love it.
Sure. Thanks, Lori, for having me. Like you said, my name is Colleen Lochran, and I'm a family nurse practitioner with almost 30 years of experience. Initially, just started at the real sick end of healthcare, work in ICU and things like that. And then thankfully went over into more healthcare with my nurse practitioner degree. I have a hybrid medical practice now doing hormone replacement and medical weight loss, as well as basic urgent care and concierge family medicine. And it's hybrid in the fact that I do telemedicine in multiple states, but I also have a brick and mortar here in Boise, Idaho. So a special shout out to all my East Coast and West Coast patients, family, and friends. Special shout out to the listeners from Boise and the Moms of Meridian Facebook group here in Idaho. Thanks, guys, for coming on here. I know in the past I touched on how much of a game changer these GLP-1s have been for weight loss and overall wellness. And I think it's going to be spoken to again a little bit later on. But partnering with LEMD has been a fantastic opportunity for me to integrate the other peptides into my practice. It opens up a whole new level of wellness beyond the GLP-1s. And I know you touched on it, Lori, the BPC 157 for your patients with tendonitis, tendinopathy, ligament sprains and strains, muscle tears, and recovery support after injury and procedures. So your shoulder surgery patients, your knee surgery, hip surgery patients, this could really just accelerate the healing process for them. Similar to TB 500, I know they can stack those, enhances the flexibility and reduces inflammation in the larger muscle groups. The GHK-CU, which reduces pain and promotes nerve regeneration and tissue repair. So great for your back pain patients, your sciatica patients. And I think you said you're going to go into a little more detail on that as well.
Yeah.
And then, the amazing Tesamorelin, Samorelin, Ipamorelin, supporting the growth hormone release, which can aid, again, in tissue repair and especially in the lean muscle growth. So all of you gym rats out there that are really working on strength training, these particular peptides can really assist with that lean muscle growth. So super excited to be on board with LEMD and provide my patients not only with the GLP-1s, but also a multitude of other peptides for wellness. So thank you, Lori. Thanks,
Yes,
LEMD,
thank
and
you.
super excited to be working with you.
Awesome. Thank you so much, Colleen. We are really excited to have you as a resource as well.
Yeah, I'm
So
excited.
I want to touch briefly on just the sourcing of the peptides because this is very important. And as I work with, I think I've got now, I don't know, well over 100 clinicians that I'm working with directly that are partnered with LEMD. But it's very important that the source of these peptides is of the utmost safety, efficacy, potency, purity, and also being medically supervised because there are gray market and black market peptides out there that people are buying. They have no idea where they're coming from. They're coming from, overseas. They're not filtered and they're not medically supervised. LEMD peptides, what I love about it, and I feel like why so many providers have come on board to offer these through their clinics is because they are medically supervised. So these peptides are prescribed by licensed MDs and DOs as part of the LEMD telehealth platform. The pharmacy that they use is a pharmacy in Texas. It's a compounding pharmacy that is 503A certified. So that is the highest standard of a compounding pharmacy. The facilities are FDA inspected as well as the ingredient suppliers, and they are potency verified as well as they have independent lab testing. And they are triple and quadruple filtered for contaminants. So, in terms of making sure that if you are going to take a peptide, that they come from a great, good quality source. Um, I personally feel very comfortable with them. And I know a lot of the providers that I've worked with that have done a lot of research, before they decide to partner, they really value this as well. So I will put in the chat for everybody the Clover Pharmacy if you want to check it out. But that is the pharmacy partner in Texas that LEMD uses. So, first peptides group that we're going to talk about is for weight loss and microdosing, the GLP-1s. And I know everybody knows a little bit about GLP-1s, but I have Dr. Jessica Chung here. Dr. Chung is the medical director at JC Healthcare Associates in Tampa, Florida, as well as she is a girl boss. I got to tell you, this lady, she runs as fast as I do, and that's hard to do. So she is a girl after my own heart. But she also is in charge of a group called the International Business Association for Nurses and leads nurses across the entire country and inspires them. So, Dr. Chung, if you wouldn't mind, maybe share with us a little bit about your background, and then I know you're going to share a couple patient testimonials about the GLP-1s.
Yes, thank you so much, Lori. Thank you all for joining. Excited for those of you who I personally invited. Thank you for joining this webinar. So, as Lori mentioned, I'm Dr. Jessica Chung. I am a doctor of nursing practice and a board certified family nurse practitioner. I am the founder of JC Healthcare and Associates, which is a direct primary care practice based in Tampa, Florida. And I'm also the founder of the International Business Association for Nurses, where we educate and help healthcare professionals and nursing professionals build healthcare practices and expand access to care. And that led me to join Lori with LEMD. So excited about that. And so LEMD, it allowed me to not only just educate patients and the community about peptide therapies, but through LEMD, I'm also able to work with, I think now I'm about 30 healthcare providers and wellness providers, and helping them in helping their patients and clients access safe peptides. So before I get into the science, I do want to share my personal story with peptides, which are the GLP-1. So these medications aren't not just something I prescribe or educate about. There are something I've used in my own journey. So like many people, you struggle with weight. And as we age, we struggle with weight even more. And as a healthcare provider that understands, nutrition and health, I still experience the same frustrations that many patients do. So you try everything, you work out, you eat better, you fast, you do all the right things. And sometimes your body's just not responding, or maybe there's some underlying condition that doesn't allow you to lose weight as you want to. So I did started using semaglutide, which is a GLP-1 medication. So I started with that and I lost about 30 pounds. And what it really did for me is it really did help to regulate my appetite. And it really helped to make easier choices, and I should say better choices in food. So with just starting the GLP-1s, I completely lost cravings for a lot of junk food and sweets. And that's something I teach my patients, is that they don't have to try to figure out how to eat healthy all of a sudden, that the GLP-1s actually, help you to decrease your cravings for a lot of foods that aren't good. So I did reach a plateau, which is very normal in your weight loss journey, right? Because this is a journey. And so your body does adapt metabolically. And so I transitioned to tirzepatide, which works both on the GLP-1 and the GIP pathways. So that allowed me to continue progressing in my journey. So when I talk about these treatments, I'm speaking not just as a provider, but also someone that understands the experience personally. So I do, as I show, I have 3 of my patients that I'm showing their before and afters, because I'm going to talk a little bit about some things and stigmas I want everybody to know, and things we don't want to have these stigmas and myths. So GLP-1, that stands for glucagon-like peptide 1. So it's a hormone that your body naturally produces. It helps to regulate blood sugar, appetite, and digestion. And so medications like semaglutide do mimic this hormone and help to reduce appetite. It does also help to improve insulin response and slowing of the gastric emptying. So that combined does help you to feel fuller longer and stabilize your blood sugars. So medications like tirzepatide work a little differently because they target 2 hormone pathways. So activating these pathways together, they can have an additional metabolic effect for some patients. So both of these options, both of these GLP-1 options are effective. It really just depends in regards to your medical history, how much weight you need to lose to determine, or for your provider to determine which one you would start with. So I'm going to show my patients and their progress. And, all of the patients I'm showing, they've either have been on one or both of the GLP-1s. And so one thing I want to emphasize is that there should not be any stigma around using medical support for weight loss. For some reason, society treats weight differently from other health conditions. So if somebody needs something for blood pressure, diabetes, we don't have any issues with, treating that or going to the doctor and get medication. But when it comes to weight management, there's these stigmas that, we would like to dispel and show that people, no matter where they are, what size they are, how much weight they want to lose or need to lose, there should be no stigma around using these treatments. And another myth that I want to dispel is that you have to be close to your goal weight to see results from these treatments, which is not true. Many of my patients who started at higher weights, higher BMIs, have seen significant weight loss and improvement in their health and are continuing to see that even as they continue on their journey. So what these therapies do is that they help to change the relationship with food, not just losing weight. So they cut down the hunger noise and they allow you to make healthier choices more consistently. So it's important to remember that these medications do work best when they are combined with healthy habits, and especially improving nutrition and incorporating physical activity. So the goal is not just the weight loss, the number on the scale, but the goal is better metabolic health, better energy, and better long-term wellness.
Awesome. Thank you so much, Dr. Chung.
Thank you.
Wow, I got schooled in GLP-1s there. That was amazing. Thank you. So along the same lines of what Dr. Chung just mentioned, and then we're going to get into some of the other longevity peptides, is this, I think, mimics what a lot of providers see in their clinics as well. And this is a study that looked at 2,000 patients that took GLP-1s or just had healthy diet and exercise. And the people that just did healthy diet and exercise, they lost about only 2.4% of their body weight. And I feel like, gosh, that was me. I'm doing all the things and I'm busting my butt and barely can move the needle. Whereas the people that did the GLP-1s lost a significant amount, 15 to 20% of their total body weight. And again, it's just replacing what your body used to have when you were younger. And there are a lot of other health benefits. Again, Dr. Chung did a great job touching on this, heart health benefits, brain health benefits. And you'll see that a lot of people, myself, I've already hit my goal weight. I continue to stay on a microdose GLP because of the other health benefits. Sleep apnea, again, tirzepatide is actually now approved to treat sleep apnea. And then, as Dr. Chung mentioned, addictions and cravings. So for me personally, not only did it turn off food noise, but I literally have no desire to drink alcohol or anything like that. So it really turned that off. Or if I do want to have a glass of wine, I can have one glass of wine. It's not that big of a deal. I don't feel like I have to, keep going. Microdosing. So again, this is what I personally did. So you don't necessarily have to be considering these peptides just for weight loss. A lot of people now, and again, the celebrities, they use this for other health benefits. So a whole host of health benefits for microdosing, just that itty bitty dose once a week. LEMD offers GLP-1s that are personalized for each patient. So they have an injectable as well as oral drops. Now, the injectable is obviously the most effective because it gets right into your system much quicker without having to go through the liver and the stomach. But they do offer oral drops for anybody that is like really, really nervous about needles. I will tell you, I was kind of afraid of needles. These needles are so small, you inject them at an angle, you literally can't even feel it. They customize each dose specifically for that patient's BMI. And then as a patient, you get to choose your additives. So, like for me, I added B12 because I'm low in B vitamins. The pricing is very reasonable. In fact, they last month they just reduced the price. So the weight loss dose starts at 299. The microdose starts at 239. You can use HSA and FSA as well. They've got an awesome protein. I actually have this every single day, so this kind of helps me make sure that I still get my protein. And then we're going to touch on the longevity peptide. So I'm actually going to bring up Raquel Landry, who is also a nurse practitioner, and she's a personal user of NAD, but then also offers these in her clinics. And Raquel is actually on vacation and is here. So thank you, Raquel. You're so sweet.
No problem. Well, thank you to everybody for joining us. I'm excited about the opportunity to be a part of this. I've been using, so I'm a dual certified family and psychiatric mental health nurse practitioner. I do have a med spa, Belux Health and Wellness, located in Lafayette, Louisiana. We also have branch offices in Lake Charles and New Orleans. But let's get right to it. NAD has been helpful for me as a provider, but I've also been able to witness the improvement or how NAD has impacted one of my clients. So what NAD is, it's a coenzyme that's found in every cell of your body. So as we age and as our bodies undergo stress, our NAD levels tend to drop. So for me, yes, I'm a nurse practitioner. Yes, I'm a provider. Yes, I am an entrepreneur, but I'm still a human being. So for me, I went through periods of brain fog. I started taking NAD, and I guarantee you my staff had noticed a complete difference where it was starting to help me to increase revenue. And people like, well, it doesn't make sense. It does make sense because by me taking NAD, it helps me to make better business decisions to be able to lead and guide my staff. And it was interesting, like I said, they could tell when I took it and they could tell when I didn't. Another story I just want to share real quickly, and then, I'll stop talking. I did have a client, I think this was last month sometime. She came to me after hours, like called me and just saying, hey, I really, really need to see you. I didn't know what was going on. She came in and I discovered that she was having some relationship issues and had gotten to the point where she was suicidal and homicidal. Although she denied it, by the time she got to me, the only defense that I had in terms of, what can I give her right now that can kind of help with what she was going on from a mood standpoint. I did give her NAD and she had a 360 turnaround in less than 24 hours. So she came back the next day and was like, baby, I don't know what it is that you gave me, but I'm going to need to definitely continue that. So, NAD has a lot of great benefits because it helps with stress and anxiety. It helps with brain fog. It decreases inflammation. It helps build your immunity. It has anti-aging properties. It helps you to sleep better and also gives you energy, and it aids in the addiction recovery process. So NAD is just one of those that I feel is, imperative to have, if you're looking for all of those benefits. And thank you guys for letting me speak. And I'll turn it over back to you, Lori.
Thank you so much. Yes, I echo what you're saying. I love NAD. I have that as part of my stack. So B12, honestly, I just add my B12 to my my GLP, but they do offer B12 and then BPC 157 TB 500. Colleen touched on this at the beginning. This is very popular. Joe Rogan, you'll hear on his podcast, he's talking about this particular peptide. This peptide is great not only for healing muscles, tendons, ligaments, for the injectable. My mom is currently also on this and she's doing the oral version of it. It's also really helpful for gut health. So you'll hear about this a lot with athletes. And then again, even older people as we age and we've got injuries, those nagging injuries, this is a great peptide. Thymosin alpha 1, this is one of the newer ones that Ellie has launched. This one really is great for your immune system as well as wound healing and anti-aging and longevity. Methylene blue, this is another really popular one with the celebrities. They also just recently launched methylene blue, so cognitive function, oxidative stress, as well as mitochondrial health. And then the Tesamorelin. So I actually did 2 rounds of Tesamorelin kind of before GLPs came out. So it was a few years ago. This stimulates your body to release your own growth hormone. And so the best way for me to describe this is when I think of my kids when they were growing up and they could sleep like 12 hours a day. And part of that is because as they slept, they were releasing growth hormone, which is why my son would wake up and it would be like, man, did you grow an inch overnight? Well, he kind of did because as teenagers and as kids, we're releasing a ton of growth hormone. Well, as we get older, that significantly declines. So when you think about it, why are you losing muscle? Why is it more difficult to sleep? Well, it does tie into growth hormone. So this is not a growth hormone. This is telling your body to release your own growth hormone. And so Tesamorelin, Ipamorelin is kind of the newer version of Tesamorelin, and it's again stimulating your body's natural production. So I'm actually going to have a couple of special guests, Abby and Jason Blonshine. So Abby and Jason have an amazing diagnostic center in Lansing, Michigan. And Jason was so nice to share his results with us. So this is the DEXA. And Jason, I'm going to have you, if you don't mind, just share a little bit about what I love about this is objective data. This isn't Jason just looking in the mirror. This is Jason doing a diagnostic test before and after and really seeing the changes in his body after using Tesamorelin. So would you mind sharing with us real quick, Jason?
Yeah, absolutely. Thank you, Lori. Yeah, Abby and I run a diagnostic performance center here in Mason, Michigan. I'm a registered respiratory therapist, registered pulmonary function technologist, a lot to say there, with a lot of experience in the hospital and research. So we do a lot of VO2 max testing, and DEXA is one of my favorite things because I've been tracking my body composition over a couple of years now. And when I tested myself in December, I had lost a little more body fat, which I was happy about, but I actually lost a little bit of lean mass as well, which I was not so thrilled about. And I've been working to try to put more on to get to my goals. And so yeah, I tried the Tesamorelin, Ipamorelin stack. I did that for 2 months. What I didn't really realize, I don't know if I didn't notice, is how well I would sleep. I slept better than I've slept in 10 to 15 years. I would take my injection at night and I would sleep through the night until I woke up. I wouldn't wake up a single time throughout the entire night. But I did that for 2 months. I didn't change a single thing, not in what I was eating or my training or anything on a daily basis. So to say that I was shocked when I gained over 8 pounds of lean mass over that time is a bit of an understatement. I did not expect that. I expected hopefully to get 3 pounds or so, which is sort of what I've been able to do over 3 to 4 months usually. So this was a really positive shock for me.
You can
And the
see
other
it.
thing,
I mean, it's
yeah,
crazy if you look at like just like this area of your DEXA scan, you can really see the difference in body fat as well.
yeah, you can see that. I don't know if you can see it real well here, but even the concentration of red actually shows on the DEXA scan. So
Hmm.
it even kind of shows intramuscular fat. So yeah, I did those, and that was just 2 months apart. And then yeah, this is the other really shocking thing for me is that my visceral fat went from a 92.7, that's area, and really the healthy range is 100 and under, or a no risk range. So I was really just under that 100 range. But it dropped 25 points in that time. And again, I didn't do anything else besides what I was doing before, except taking that peptide. So I was impressed. I'm kind of excited to give it another go.
Well, and what I love about this too, you guys, and I would encourage you if you have access to a DEXA or you have access to an
Mhm.
even an in-body scale, is being able to track this stuff, because a lot of times people work their butts off and they're not seeing the scale move, but the amount, like just looking at this, you added lean muscle mass and you reduced visceral fat, which is the dangerous fat around your organs, in a very reasonable amount of time just by the help of peptides. So I love that. Thank you for sharing. Thank you for, putting your body images up here for all of us to
Yeah.
appreciate. That's
Yeah,
pretty
those
brave.
images don't lie.
That's brave. So thank you so much.
Thank
So
you.
I do want to touch on sexual health as well, real quick. So PT-141, this is available in an injection and a nasal spray. The nasal spray is the newest one. This is great for sexual dysfunction in both men and women. And again, this is something people don't like to talk about, but it is something that does happen as we age. And so there are peptides that can help with that. And then lastly, I want to bring on an amazing nurse practitioner and friend, Marisa, who is an owner of Forever Young Aesthetics in Birmingham, Michigan. And maybe you could share with us just a little bit about your office as well as the skincare peptides, if you don't mind.
Yeah, no problem. Thank you, Lori. Thank you, everybody who's here, my patients, clients, friends, families. Um, it's been a great journey. I am a family nurse practitioner, been an NP 16 years, nurse 20 years, owned my own practice for the past 4 years. Again, Lori said it's in Birmingham, Michigan. Um, I've been on the weight loss journey for 3, 4 years through with like helping my patients and treating myself because why not? Um, but what I've done is transitioned a lot of my patients into LEMD because I can't personally do it myself anymore, just with legality issues with the med spas. It's just easier for me because I'm a solo provider. But what I got to do with this is with LEMD is bring on the peptides. Again, you've heard everything. I'm not going to discuss and for a long time about all of the medical background, but GHK-CU, I'm a med spa. It's what I partner with almost all my clients, and I push if they're comfortable, right? GHK-CU is a copper binding peptide that is made of 3 amino acids, which helps with tissue repair, wound healing, and cellular regeneration. What that means is as we age, all of the GHK-CU in your system ends up declining with age. So we need to replenish it. So what this does, it helps stimulate collagen and elastin production, improves fine lines and wrinkles, because who doesn't need that? Reduces inflammation, improves skin tone and texture, and supports amazingly hair follicle health, which is what happens when we're dealing with menopause or aging. So I do believe that we can do this injecting, but also topically, it is very beneficial also. I am a fan more of injecting. You can do it about what the
Okay, real quick.
instructions are is like one injection 5 times or one time a day for 5 days for what am I trying to say? One time a day for 5 days. Um, and then you take 2 days off. So it's five days a week, 2 days off, and then you keep doing it. But it works really well.
Yes, I personally take this. I've seen a lot of improvement with my hair. And yesterday I was so excited. Somebody thought I was 40. I wanted to give them a hug.
Nice.
And I'm going to attribute it to this.
It's an amazing peptide, I'm not gonna lie. And it's blue. So
Yes, it is a really cool color. Yeah. So another really popular peptide. Yes. Thank you, Marisa, for sharing that. And the topical, I do use the topical one as well. It's $149. It's 2 months supply. Honestly, mine's lasted me 4 months. So
yeah,
this
that's
one is really great. I just put it on, before bed. So I did want to share real quick the patient journey. So we've gone over kind of what the peptides are and the benefits. Essentially, how this works is if you are interested in learning more about LEMD, I would get back to the person that invited you tonight and they can share their link. And then basically you sign up for a free customer account. There is no memberships with this at all. You will pick the products, and they're all listed on the website. They tell you the benefits. They have the clinical studies attached if you want to dive deeper into it. And then you'll throw the peptide in your cart, and a HIPAA protected health assessment form will pop up. And they're going to ask some questions about your health history, your height, your weight, any other medications that you're on that they need to be aware of, if you have any other health conditions that might be a concern. And the LEMD doctor is going to make an appointment with your file, and they're going to review your health assessment and determine, is this peptide safe and effective, and then what is the appropriate dose for you. Typically, you're going to hear back from that doctor within a few hours, at most 24 hours. And then the peptides are actually shipped directly to you. It includes the shipping. It includes all of the supplies. These peptides, again, are coming from a reputable source. They're already constituted, and it comes with everything you need to get started. You actually even get like this super cute little water bottle that they come in, and then there's a little ice pack in it. So it's packaged really cute. And then you also get 24/7 direct messaging support with the LAMD doctor. So if you have a question about dosing, if you have a side effect, anything that you need, you have direct messaging support, and that is unlimited. There's no extra charge for that at all. So it's pretty straightforward. So if it's something that you want to look into, again, I would say get back to the person that invited you. You can create a free account through them. You can go ahead and research the peptides. You can fill out the health assessment form. And again, the peptides, they ship within 7 to 10 days. They come, some of them will come even quicker. I'll get mine sometimes in a couple of days. So it's really, really easy and smooth. I did want to pause here. I know we have some folks that want to learn a little bit about the brand partner side of things. So if you are interested, I'm going to pause for just a couple of minutes in case there's people that want to just go ahead and, message and get information about the peptides. But if you're interested in the brand partner information, I'm going to take just a couple minutes just to talk to you guys about that. And it looks like we actually have a whole host of questions. Yes, this is recorded. Oh my goodness. Wow. Okay. Awesome. Lots and lots of great comments in. All right. Awesome. Thanks everybody for all of your comments. All right. So we're going to touch on the brand partner side of things. Again, if you are a healthcare provider, if you're a wellness professional, and honestly, even if you're just somebody like me who cares about health and wellness and wants to be able to help other people get access to safe, medically supervised peptides, LAMD does offer a brand partnership. The telehealth platform has providers that are licensed in all 50 states. So I know a lot of the clinics that I work with, they're licensed in one state, and so they're not able to really offer peptides to people outside of their state. Partnering with LAMD does allow you to offer these peptides in all 50 states. If you are a clinician or a med spa owner, or you own a diagnostic center like Abby and Jason do, you're keeping your client relationships. So they're not really meddling in whatever other things that you're doing with that patient, whether it's lab testing, whether it's their other lifestyle modifications that you're working with them. They're just simply managing the prescription of the specific peptide. Brand partners earn between a 20 and 40% commission on the peptide orders, and that is based on point value of each peptide. And then they also have some fun incentives and recognition as you kind of move up the ranks. The compensation structure is a scaled structure, and it is based on volume. So you start at 20%, you can get up to a 40% commission. It kind of depends on, again, how many peptide orders are running through your business. But then they also have a referral program, and not everybody wants to do the refer a friend program, but they do offer one. So if you have another friend or a nurse that you went to school with, or somebody else that that's really into peptides and maybe wants to get their peptides at a discount, you actually earn a 7% commission on any referrals that you bring to the business. So, and then this just gives you a sample scenario of 10 patients or 10 clients on a GLP-1 over the course of a year, can really be a nice revenue source for you and your business. And then the biggest thing that I personally love about LAMD is the education. So we offer these webinars. Currently, we're doing them every other week. And as a new brand partner, you can come on, you can invite your patients or your friends or your family to learn about peptides. You can come on and share a little bit about yourself and maybe your personal story. And it's a great way that you don't have to be a peptide expert. You can piggyback off of the education that we're providing. In addition to our webinars that we do, our live webinars, LEMD puts on webinars every single week as well. Men's health series, women's health series. We have one coming up where one of the providers is going to talk about peptides and endometriosis, which is a really exciting topic. So lots and lots of education. We're here really to educate and empower people, not to sell them stuff. So I really personally love that because I feel like at the end of the day, if we can share resources for people, they can take control of their health and they can make an informed decision. And we're really just here to kind of empower them with that. So if you are interested in the brand partner side of LEMD, again, you can get back to the person that referred you. The cost to be a brand partner is $79. So it's crazy that it's only $79, but it's a one-time fee of $79. The only ongoing fee is an $8 tech fee that gives you access to the order page that you get. And there's no minimums, there's no maximums, there's no quotas or anything like that. And your website where people can order from you is literally live within 5 minutes of you starting. So, and then the other thing, just as a team, I am here to support you. The rest of our team is here to support you as well. So it's a really nice way to be able to offer peptides in a safe and compliant way, and also earn a little bit back. You can get your own peptides and make a commission back on your own peptides as well. So I think that is the end of what we have today. We still have a huge number of people on here. So thank you guys for attending. I will get the replay out to everybody, and the person that invited you has a lot of resources to answer questions and things like that as well. So if you have any questions, definitely let them know. They will get back to you. And then we're going to have our next webinar actually will be on the 24th of March. So hopefully you guys can join us then. Again, thank you for joining. I hope you all have an amazing night, and I hope this was valuable information for you. So, and thank you to all my panelists that joined as well. I appreciate it. All right. We'll see you guys next time. Bye-bye.